Hi everybody, my name is Vanji David and today we'll be performing a tracheostomy care procedure. So for any procedure, I just want to remind you, let's not forget our patient identifiers, our patient privacy, and of course good hand hygiene. So you'll be donning and doffing gloves throughout this procedure, so make sure you do that in between. And this procedure also requires a sterile step, so make sure you mind your sterile field, have have your hands free from any jewelry, and roll up your sleeves. Okay, so anything below your waist is not considered sterile, so have a trash bin nearby where you can just drop your dirty supplies in. Okay, so now let's start. Patient privacy, hand hygiene. Good afternoon, sir. Can you please state your name and date of birth for me? Thank you. My name is Vanji David. I'll be performing your tracheostomy care for the day. Is this a good time for you? Thank you. So you got your patient consent. Good nursing practice. Inform your patient ahead of time what you'll be doing before gathering your supplies. Okay, so that's just work effectively and work smart. All right. And then this is a good time for you to assess your patient as well. How is he breathing? How does he look like? How is his skin color? All right. So have a pulse ox with you. Attach it to your patient. Make sure it's on the patient at all times throughout the procedure so you can monitor his vitals. Get your numbers in. Also a good time to assess your stoma site. Is there any drainage? Document on it. How about the placement of the trach? Okay, document on that as well. And at this moment, if the patient needs any suctioning, it's a good time to do that. After suctioning, remember to reoxygenate the patient as needed, depending on his condition. All right. So, Mr. Smith, I'll be coming back. Let me just gather my supplies. Is that okay? Thank you. Hand hygiene out of the room. Gather your supplies. Coming in. Patient privacy, hand hygiene. Mr. Smith, good afternoon again. I'm here. I have my supplies. Is it okay if I start arranging my supplies? Thank you. So this is a good time. Again, assess your patient. Look at him. Look at his vitals. This is a good time to reposition your patient. So this procedure requires your patient to be on a semi-Fowler or Fowler position as tolerated, okay? And have a good working height as well. Usually you'll be standing up for this procedure. And technically, this requires two people, this procedure, but in the real world, everybody's busy, so I'll be showing you how to do it on your own. Okay, it is possible. All right, so at this time, we have our supplies. Let me just arrange, Mr. Smith, my supplies. Are you okay? Talk to your patient. Okay, so we are going to open this sterile tracheostomy kit. It's sterile, supposed to be sealed, okay? Away from you. That is how you open it, and you tear it open. Okay, remove this flap. Set it down. You have your dressing pad, which is sterile. You have an inch border leeway to touch it. Do not let it fly around, and you're just going to drop it on your table. Okay? I'm just going to move this. You can maneuver by touching the inch border, outer border of it. So our goal right now is to have everything inside that sterile field. Do not hover around that area. So just drop everything in. For the purpose of the video, I am going to move this over. All right. And I just want to show you the compartments. So we have our cleaning solution, we have our hydrogen peroxide, and our normal saline. So hydrogen peroxide goes in only one compartment, usually the big one. This is where we'll be cleaning our inner cannula. All right, for the other compartments, all three actually compartments will have normal saline. Okay, so one compartment will have 50-50 solution for our inner cannula. Okay. So now let's start. So Mr. Smith, I'm now going to start the procedure. First thing I need to do is to remove your inner cannula so I can clean it. But anytime that you feel uncomfortable or any pain, let me know by raising your hand. Okay, so hand hygiene, we're now donning our clean gloves. We're not doing sterile yet, it's only clean. All right. Okay, Mr. Smith, I'm now going to start. Let me know if there's any pain or anything. You might feel a little bit of pressure, okay? So support your trach. So just remove, pull it out, turn it if there's a lock, turn and pull out towards the curvature, within the curvature of the inner cannula. So there you go. And then you drop it in your 50-50 solution. Okay, I just want to show you, you're not going to do this, supposedly leave it in there. This is not an inner cannula. This is an operator. So this should be at bedside at all times by your patient in case of any emergency. So for the use of this and everything, that's another video. So have it by bedside. Should be an inner cannula. Will look like a cannula. It will be a tube-like equipment. All right. So have it in there. And now, of course, you're going to remove your dirty dressing. Okay. And now you're going to discard. All right. So if patient needs to be reoxygenated, look at your patient, look at your numbers, oxygenate the patient, talk to your patient. All right. So at this time, we are actually done with our clean procedure. All right. We are now going to discard your gloves. Just throw it the usual way, supposedly. Okay. There we go. Hand hygiene. And we're now going to our sterile procedure. So I'm just going to move that over for the purpose of the video. I just need to move everything. And I need to get the sterile gloves. All right. So you have a leeway as well to touch the edge of the glove. I mean the packaging. All right. Mind your sterile field still. Do not hover around that area. Move this over just for the purpose of the video. Okay. Do not touch the inside. Pull out. Okay. Pull out. Do not touch anything else over that area. So nothing is sterile as of the moment. So what I'm going to do is I am going to go inside the cuff. There we go. Not making sure I'm not touching the outer part of the glove. So now I'm going to maneuver my hand in. There we go. All right. And now this is sterile, so I can now put my hand at the outer side of the glove. All right. Making sure I'm still minding my field, not touching anything else. Okay. Keep your hands up. This is considered sterile, but we don't need that, so we can throw that away. All right. So I'm just going to, purpose of the video, I'm just going to, actually, technically, you can do this one since it's sterile inside. Okay, move it. So now I'm going to keep my dominant hand sterile and then this one clean, touching the dirty areas. Okay. So now I'm going to clean your inner cannula. Are you okay, Mr. Smith? Are you doing okay? So now we take our inner cannula. We are now going to clean. We take our brush, go inside the tubing, brush outside on the sides, inside. Okay. Throw. And now we're going to rinse in our normal saline solution only. Rinse, tap, tap. We're told the trachea site inside is a humidified environment, so you don't really need to dry this fully, okay, since it's going in a humidified environment anyways, all right? So right now we are going to reinsert your inner cannula, Mr. Smith, so let me know again if you feel that you need me to stop. Just raise your hand, okay? So check on his vitals, check on your patient. We are now reinserting the cannula. Okay. There you go. Reinserted. All right. So now what we're going to do is we're going to clean around the stoma site. So we're going to use our cotton buds right here, using the normal saline only. Again, not the one with the hydrogen peroxide. We don't want that on your patient's skin. Okay, so we're only using the normal saline solution. All right. So there you go. Clean, 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 clean. Drop. Get another one. Normal solution. Clean, clean, clean. And then drop. And then, of course, we have our phalanges, the ones on the side, the ones with the curvatures, and if there's any crusting, you can use your pipe cleaners as well. So dip in a normal saline, clean the insides, make sure you get all that crusting out, check on your patient, talk to your patient, drop. So now, this one is very important. Now we have to dry that area. Okay, so we have to look for your 4x4 gauze, okay, dry, and now we are drying this area, okay, slowly. All right, there you go, slowly drying, drop. Okay, now last but not least, we're now going to replace your dressing. Okay, we're going to put a clean one, a sterile one. So I'm just going to put a new dressing on your stoma. Mr. Smith, how are we doing? You're okay? How's his breathing? Check his oxygenation. Remember your numbers because you're going to have to document that later on. Okay, so now we're set up like that. All right, so we're done with the sterile procedure. We're now discarding this. Okay. So at this moment, check your patient again, talk to your patient, discard everything. We are done with that. So I just want to inform you, that's why we still have our ties. We are doing this by ourselves. We are not removing the ties, so we have to make sure that the trach is intact. So we're going to do it, if you're by yourself, do it one side at a time, okay? So now we have our string right here. What I did, there should be a buttonhole at the end. We're going to insert this end, okay? Just cut it, fold it, and then put a slit, okay? So we're now going to, I'm sorry, this is my patient's skin, supposedly, because my patient doesn't have a neck, so that's his neck. So assess your patient. We're now going to remove the first tie. Reinforce, stabilize your trach. We're going to remove this side. Okay, you're going to insert this one on one side. And now you see the buttonhole. You're going to thread this through that. This is the one tie step. Okay. Now that's done. Make sure the knot is away from your patient's skin. Okay, away. So now we're going to go around. Around. Make sure it's not twisted, not too tight. Now we're going to remove this part. You're reinforcing, remember? Okay, make sure it is stable. Remove that part or have this in first before you remove it. Okay, since you're working alone. So now you're going to thread that in. All right. See, okay. So how do we know the tightness? How do we gauge the tightness? Make sure we can insert 2 fingers in between, okay? The patient's skin and the tie. All right, and now you're going to do a double knot. Okay, after you do a double knot, you can put a 4x4 gauze in between that and then tape it. Make sure that it does it for patient safety, for to prevent any skin injuries. Okay, so 2 fingers right there. That's just how it's supposed to be. All right, so making sure it's not too tight. So that is it. Hand hygiene after removing your gloves. Don't forget, and after procedure as well. And then document on everything that has happened throughout the whole procedure. Make sure your patient is safe, good height, bed in lowest position, call light within reach, reorient your patient on the use of call light, and also bedside table within the patient's reach as well. Okay, make sure you inform your patient of what just happened, ask him how he is, and come back and double check on your patient again. All right, thank you so much again, and that is it. Thank you.